look away a little bit from the routine clinical practice, and which allows you to affect more lives. You remember the Commissioner for Health was talking about a population health. Sometimes when you do clinical practice, you are just by the patient's bedside. But there are a whole lot in the community having, if not the same, something similar that you can prevent. And this is why this topic, I know it's going to be ongoing, but it's very, very critical at this time. Thank you.
Very well, thank you very much, sir. Can we please give Dr. Ayubusi a round of applause for that? Yeah, so haven't heard from you both, I think we could get straight to the core of the panel. Now, today's topic, this panel's topic says leveraging public-private philanthropic partnerships for improving health outcomes. Now, as a way of introduction, of course, I would use something very similar, very funny. The public, in this instance, has to be the government. And of course, the government cannot do everything. For every time the government has done something, we've seen financial deficits. And the funny example I have to give is the school fees that we pay as medical students in Ife. We saw that at some point, the government could not, the public could not fund it that much anymore. So the college leadership through the provost, had to start seeking for private donations that came from our alumni, because ideally they do not owe the college that money, so it was private donation. And then you got to see how the meager fees that we paid as students from the, of course, to the public, and how the government came in, and how the private sector, how they had that collaboration. Then in addition to that, imagine, say, an organization, a not-for-profit organization, comes to the college and maybe donates a new laboratory, for example, philanthropic donation. So essentially what we're talking about in this panel is the public, that's the government, the private sector, that's the business sector, and the philanthropic sector, that's the not-for-profit sector, them coming together to form a partnership, an alliance that could improve health outcomes. Now this is critical, this is important, because there's a huge amount of funding that the Nigerian healthcare sector needs, and that money cannot come from the government in its entirety. Right, so, and that's why it's important to have these conversations as part of the goal of transformative healthcare. So it's going to be a very interesting panel, I assure you, less of technical terms. We are talking business, talking economics, talking health financing, health policies. So please feel free, and definitely our provost and our commissioner will be contributing to the discussions as we proceed, because the commissioner is a representative of the government in this panel, unofficially anyways. So yes, everybody will collect eventually. Yeah. Right, so I think we can get to it. So to save us of time, I would regularly summarize public-private philanthropic partnerships as 4 Ps. So when we say 4 Ps, I hope we get what it is right now. I hope we get it. Thank you very much. So I would start with you, sir, Dr. Olabanji, and I would say that, can you share examples of successful 4 Ps in the health sector that have significantly impacted the sector, and maybe add a couple of factors that you think contributed to making it successful?
Okay, let me start by saying that partnership is a key word now globally, and even in global health, that government alone don't have the resources to fund everything. In economics, we say resources are scarce. So people from the private sector, people from the philanthropic sector, which you call the 4 Ps now, public, private, philanthropic, and partnership. Okay. So Nigeria, the health sector has been blessed with a lot of donor funding coming from, which may be bilateral or multilateral organization, and also have foundations. A common one that all of us may be familiar is the Dangote Foundation, the Bill and Melinda Gates Foundation. And you know, these two foundations has really supported the health outcome of Nigeria in many ways. If you look at the issue of malnutrition in the Northeast, around the year 2016, I know Bill and Melinda Gates Foundation spent about as close to about $100 million there. They also work in the area of maternal and child health, immunization. Most of the vaccines we get from even Gavi, there are foundations that provide some resources, some counterpart funding, where we expect the government to bring in some resources. And good example, even during the COVID-19 pandemic, most corporate organizations in Nigeria came together under the umbrella, forgotten the code, Nigeria, is it new Nigerian business, there's a code for them then. They pull up resources for palliatives, for COVID testing, those things actually, help the government to provide services to people. So Nigeria really, we've had some good examples of this, but I'm sure as we go along, we'll talk about some challenges too, and some successes about this partnership. I think I'll leave it at that.
Very well, thank you very much. I think you said a lot, and I mean, one thing we could take from that is partnership is key. Certainly, resources are scarce. So definitely, when we see partnerships happen, it only takes us into achieving our goals in a shorter time. Of course. So I would want to hear from you, Dr. Ayegbise, but not entirely on the angle of successful 4 Ps, because Dr. Ogunshola already spoke about that. I'm aware that, I've read that your work is majorly focused on the South communities, vulnerable populations. You focused on that. You work in Ife anyways, and Ife fits quite that well in that. So from your experience, would you want to share how have you seen the 4 Ps really promote equity and accessibility in underserved and vulnerable communities?
Thank you very much. One of my major clinical practices is obstetric fistula. And if you will know very well that this majorly affects women that are downtrodden, majorly. Patients, women that instead of delay seeking health care, and those that, even when they seek healthcare, they seek healthcare in the wrong place, and they eventually or develop obstetric fistula. It's a community problem. And one major problem we have is the fact that most women are not even aware that this is a major problem. And those that are even aware, they are not, again, seeking care at the right place. Currently, we have some partnerships. For example, Operation Fistula in Texas, and First Fistula Foundation that has given us grants. Currently, we treat them free, entirely free. And that is part of what Dr. Was saying, yes, that some of these are part of the partnership that has been, effective in helping us to solve some of these few clinical problems. I practice in Ife, and you know how difficult it is for most of the patients to pay for their bills. Oftentimes, they pay from, out of pocket, and there's no health insurance. So some of these women, once they are aware now that we can be treated free, they come easily, and these partnerships, they are the ones giving us the money to be able to fund them, the surgery. We even feed them. We then give them transport, even back home. So these are partnerships that have been very successful over the years, and some of our patients have, benefited from it. But majorly, of course, we'll discuss basic challenges for the students. Where you come in, I guess we will discuss all that later then.
Yes, we definitely will get to a place for the students. Thank you very much for shedding light on that. So from that scenario with respect to obstetric fistula, we can see how the gap is, how we are meeting the gap, how we are promoting accessibility in a vulnerable community. Now, certainly, if that funding wasn't there, on whose spreadsheet financial expenditure would it be to ask people to come for health care, pay for that health care, and then fund their transport, back home? It is a lot, and more reasons why for the 4 Ps come in to cover a very huge gap. Now, from that perspective, sir, I would want to now pick it from there. What challenges have you identified to having that collaboration, as well as perhaps even having more collaborations? And then maybe when you're done, Dr. Ogunshola can add to that.
Yeah. First, we'll keep appreciating partnerships. But beyond that, even our people, when these informations are passed, you will be shocked that some of them will even come to tell you in the community, because we go as far as the local religious leadership, And all that put together helps to inform most of the decisions that happen in the community. So sometimes when their pastor, their fathers, or are not giving them directive that go, they don't even want to seek health care. So even when it is free, we still have challenges bringing them to the hospital. That is one. The second thing is we need an opportunity in such a way that, for example, there was a time 2 years ago, some of the students among you were hosting fistula surgery. So beyond that, we need a situation whereby, I mean, it's not about treating them, it's about them being aware. They are not aware of the problems. So the awareness, which should come from the community, and this is where medical students and social health workers among us can actually be very useful. Some of the medical students can go into community, explain these things, preach it, analyze it, discuss with the religious leader and opinion leaders. And this way, they will realize that most of these problems can be surmounted.
Very well, thank you very much. So that was concise. So yeah, we still have information sharing issues. We still have religious beliefs as problems. I mean, similar to what we have with the ongoing cervical cancer vaccination. I mean, there are so many things on Twitter. You would be amazed that people would say such nasty things for cervical cancer that has so much PR already. So how much more for obstetric fistula? So we see the challenges, and you and I know going forward where to come in. So Dr. Rishola, would you have anything to add to that, sir?
So I will talk at the national and the sub-national level, a kind of partnership, that looks at the population health. Dr. Ayegbuse has talked about looking at it in terms of clinical care. So at the sub-national and the national level, challenges with partnership sometimes could be conflict of interest. And for a partnership to work, there is a common goal. And that's why there's a partnership. We want to solve a problem. But for the government, as they want to solve a problem too, they want to be politically correct. And I will explain that. Because as we grow in this profession and begin to talk, a government, we want to address problem to show fairness and equity. Let me give an example. This is just an example. It's not real, but this happened real. But let's say Osun State now. Osun State has 3 senatorial districts. And maybe Osun South is where the problem is. And you are addressing the problem. The government may not say the solution should remain in Osun South alone. They will say there is Osun North, there is Osun West. Because those interventions are things they also want to use that they are working. So that is what I mean by political correctness. They want equity. But for donor-driven programs, we are after the evidence, science. Where is the problem? Let's solve the problem where it is. Not just throwing funds about for political correctness. So that would be a challenge. So there's always a way to discuss this, to have a win-win situation, because it's a partnership. Government has the power too in that partnership, because you are coming to assist. You can't own it. You are providing an assistance. So that could be a challenge. Another challenge that could come at that level could be a kind of communication barrier. For donor-driven, we are after results. Government is also after results, but there is a process. So that if you are running with the speed of a project, you may have a problem with the government. Because there are processes, what I mean, who to talk to. So the bureaucracy in the system must be followed. And sometimes they are right. It's just how the system runs. So there's a way a government system runs, there's a way a private system runs. So, and they vary. And if you don't understand that, there may be a problem with that partnership. So these are some skills that people need to learn as we work. Pick them up, how to engage with stakeholders, how to engage with government, It's not just straightforward. There's a process to it. And another challenge that may come too is issue about, I've talked about shared vision, use of evidence to intervene. The other issue could be issues about transparency and accountability. For donor-driven partnership, usually there are guidelines. Guidelines may be like, let me give an example. They may say for this funding, you can't spend more than 30% on recurrent. 70% must go for intervention. And that's very important because if there's no rules, you may spend all your money on recurrent. That means on people working, while the real focus will be a problem. It's just a problem in Nigerian budget. You say recurrent and capital. When recurrent is so high, that means what we are doing is consumption. We are just spending money on salary, on training of workers, on travels, on the community. So that transparency coming out, and usually the best way to address this is the MOU. Usually for every partnership, there should be an agreement. What is this partnership? What do we want to do together? How will the funding come? What are the regulations? And once there's this common understanding, then the challenges are very minimal.
Very well, thank you very much. But I suppose that you usually still have these issues with the government despite the MOU, which I think is a thing. So, Honorable Commissioner, Sir Dr. Yubanji, as I said, you represent the government here, and Dr. Ogunshola from the private sector has accused you, of course, accused the government, saying that in working with 4Ps, public-private philanthropic partnerships in improving health outcomes, that the government comes as a challenge on its own in two major ways. First, because we have bureaucracy, and then second, because the government tries to be politically correct. Just like he gave an instance where if the problem is in one senatorial district, for example, the government wants to cite a solution in all three districts because they need to win elections. They want to show people that they are working. So from you as the government, what would you have to say about that?
I'm not sure. Okay, it's working. So first, I do agree that there would always be political considerations in decision making, right? And this goes in everything that we do, even outside of government. In life, there's always political considerations, whatever terminology we want to call it. However, I think that what matters most, it behoves on the policymakers to make sure that the relevant information is available for the decision maker at any point in time. And that's always critical. And I use my example of when I was a senior advisor to the Minister of Health, Professor Adewale. There will be several things that he needs to know, or that he will know that I would not have information on, by virtue of the fact that multiple people will come to his office and see him. But what matters is that I'm able to present the data in a way that he sees it and understands it. It's then left for him to take the decision. It's the same thing with my current governor, right? Your Excellency, this is what obtains. This is the reality. There will be the politics of it. But what you want to do is ensure that as much of that information or that decision that is taken is dependent on the right information. And once you do that, then it becomes easier to continue to move in the right direction. You may get a few things that will still be based on pure politics, but the core of it will be based on the decision. When we wanted to start, and let me give you a clear example. We have 22 general hospitals in Ekiti, right, across. How do you go about renovation? You could decide, well, let's just pick 3 per senatorial district and just do 9 and say we've done it. But I sat down with His Excellency Dr. Fayemi and said, look, these are the institutions or the facilities with the highest number of utilization that we've had over the last 3 years, right? And based on my recommendation, these are the ones that I think that we should go for. And so we chose the first 11. He only added 1 in addition to that 11. So, okay, well, this is the first 11, but let's do this in addition. So whatever amount we have, let's make sure it works with the 12. Now, in this new administration, we obviously will do the rest. But if that information wasn't available, probably we'll just have chosen any facility based on political support and would not have met the immediate needs at the time. So it's always important to have the information ready to make it available in a manner that is understandable by your leader or your boss, and ensure that you provide the opportunity for them to take on that. Over.
Very well, thank you very much, sir. I think I like how the conversation has proceeded thus far. So if you are seated in the audience, whether as a clinician like Dr. Ayegusi, or as a member of the private sector like Dr. Ogunshola, or as a member of the government like Dr. Ibanji, you definitely see how the government could work, the public sector could work with the private sector to ensure that we are improving health outcomes. Now, the next question would be a general one. It would go around, including the provost. And yeah, we've had discussions around the 4 Ps. We've talked about the challenges. We've talked about successful examples, how it improves accessibility and equity. So, with specifics now, can we get to know what role does each component of the 4 Ps, each of the people involved, the government, the private sector, the not-for-profit, and all of those people, what role do they play specifically? And then how can we leverage these roles? All right, and how can we leverage this role for improved collaboration? Now, I would want you to speak, Dr. Ayegusi, in the capacity of, say, a hospital administrator.